Generally when a patient comes in and they've got spaces between their teeth, we sort of assess them and we see as to whether the actual shape of their teeth are right and the proportion of their teeth are right. And if they are, then a treatment option would be to do orthodontic treatment. And this is where we refer the patient to the orthodontist, and the orthodontist closes the spaces using braces or Invisalign. And we have Brodie, who's in the background, and she had spaces that she didn't like. With her treatment options, she could see an orthodontist and close the spaces, but if you actually look at the shape of her teeth, the proportion and shape of the teeth aren't quite right. So even if she had those spaces closed, she probably still wouldn't be happy with the smile. There are different causes for having spaces, and I think in Brodie's case a little bit has to do with her tongue, where her tongue is just that little bit more forceful. So you can actually see the spaces on her top teeth as well as her bottom teeth as well. So we did her treatment by doing porcelain veneers, and we made sure that the shape and the proportion of the teeth were right. So in Brodie's case we actually did 10 porcelain upper and 6 porcelain on the lower teeth.